The pelvic girdle or hip girdle is formed by a single bone, the hip bone or coxal bone, which serves as an attachment point for each lower limb. Each hip bone, in turn, is firmly joined to the axial skeleton via its attachment to the sacrum of the vertebral column. The bony pelvis is the entire structure formed by the two hip bones, the sacrum and coccyx. Unlike the bones of the pectoral girdle, which are highly mobile to enhance the range of upper limb movements, the bones of the pelvis are strongly united to one another, forming a largely immobile, weight-bearing structure. The hip bone or coxal bone forms the pelvic girdle portion of the pelvis. Each adult hip bone is formed by three separate bones that fuse together during the late teenage years. These bony components are the ilium, the ischium, and the pubis. The ilium is a family. The pubis forms the anterior portion of the hip bone. The pubis curves medially, where it joins to the pubis of the opposite hip bone at a specialized joint called the pubic symphysis. When you place your hands on your waist, you can feel the arching superior margin of the ilium along your waistline. This curved superior margin of the ilium is called the iliac crest. The rounded anterior termination of the iliac crest is the anterior superior iliac spine. Inferior to the anterior superior iliac spine is a rounded protuberance called the anterior inferior iliac spine. The iliac crest curves downward to terminate as the posterior superior iliac spine. More inferiorly is the posterior inferior iliac spine. This is located at the inferior edge of a large roughened area called the auricular surface of the ilium. The auricular surface articulates with the auricular surface of the sacrum, forming the sacroiliac joint. The shallow depression located on the anteromedial or internal surface of the upper ilium is called the iliac fossa. The inferior margin of this space is formed by the arcuate line of the ilium. This is a ridge formed by the pronounced change in curvature between the upper and lower portions of the ilium. The large inverted U-shaped indentation located on the posterior margin of the lower ilium is called the greater sciatic notch. The ischium forms the posterolateral portion of the hip joint. The large roughened area of the inferior ischium is the ischial tuberosity. The slightly curved posterior margin of the ischium above the ischial tuberosity is the lesser sciatic notch. The bony projection separating the lesser sciatic notch and greater sciatic notch is the ischial spine. The pubis forms the anterior portion of the hip bone. The enlarged medial portion of the pubis is the pubic body. Located superiorly on the pubic body is a small bump called the pubic tubercle. The superior pubic ramus is the segment of bone that passes laterally from the pubic body to join the ilium. The narrow ridge running along the superior margin of the superior pubic ramus is the pectineal line of the pubis. The pubic body is joined to the pubic body of the opposite hip bone by the pubic symphysis. Extending downward and laterally from the body is the inferior pubic ramus. The pubic arch is the bony structure formed by the pubic symphysis and the bodies and inferior pubic ramus of the adjacent pubic bones. The inferior pubic ramus extends downward to join the ischial ramus. Together, these form a single ischiopubic ramus, which extends from the pubic body to the ischial tuberosity. The pelvis consists of four bones, the right and left hip bones, the sacrum, and the coccyx. When standing in the anatomical position, the pelvis is tilted anteriorly, and the anterior or internal surface of the sacrum faces forward and downward. The three areas of each hip bone, the ilium, the pubis, and the ischium, converge centrally, forming a deep cup-shaped cavity called the acetabellum. This is located on the lateral side of the hip bone and is part of the hip joint. The large opening in the antero-inferior hip bone between the ischium and pubis is the obturator foramen. Several ligaments unite the bones of the pelvis. The space enclosed by the bony pelvis is divided into two regions. The broad superior region, defined laterally by the large fan-like portion of the upper hip bone, is called the greater pelvis. The greater pelvis is also known as the greater pelvic cavity or the false pelvis. This broad area is occupied by portions of the small and large intestines, and because it is more closely associated with the abdominal cavity, it is sometimes referred to as the false pelvis. More inferiorly, the narrow rounded space of the lesser pelvis, also called the lesser pelvic cavity or the true pelvis, contains the bladder and other pelvic organs, and thus is also known as the true pelvis. The pelvic brim, also known as the pelvic inlet, forms the superior margin of the lesser pelvis, separating it from the greater pelvis. The inferior limit of the lesser pelvic cavity is called the pelvic outlet. The differences between the adult male and adult female pelvis are related to the function of the body and body size. Because the female pelvis is adapted for childbirth, it is wider than the male pelvis. This can be seen by the distance between the anterior superior iliac spines. The ischial tuberosities of females are also further apart, which increases the size of the pelvic outlet. The female sacrum is wider, shorter, and less curved, and the sacral promontory projects less into the pelvic cavity. This gives the female pelvic inlet or pelvic brim a more rounded or oval shape as compared to males. The lesser pelvic cavity of females is also wider and more shallow. Because of the obvious differences between female and male hip bones, this is one bone of the body that allows for the most accurate sex determination.